Hello, and welcome to the Alamo Breast Cancer Foundation's Advocate Chat. My name is Bob Riter, and I'm here with Michael Singer. Today we'll be talking about male breast cancer. Mike, I think we met each other, for the first time about 5 years ago. I think it was at the San Antonio Breast Cancer Symposium.
Yes, well, thanks for having me, Bob, and thank you, Alamo, for having me. And my first time meeting you was at the San Antonio Breast Cancer Symposium in 2015. I had a lot more hair back then, but still as good looking as usual. And you look great. It's great to be
Thank
here.
you. Thank you. Thank you. Let me ask you, how long ago were you first diagnosed?
I got diagnosed back in December of 2010. Um, of course, total shock. Never heard of men getting breast cancer, and it was a whirlwind for a couple of years after that. I unfortunately was embarrassed in the beginning, like most men are, and it took a while for me to overcome that. But I'm loud and proud now. I went from being silent to outspoken, and from being embarrassed to empowered. And you were one of the people I looked up to in the beginning because there weren't many men to look up to who were breast cancer thrivers.
Good. It's really weird for me because it's been almost 25 years for me now. And it seems weird. I'm kind of one of the old men of the breast cancer world, which is great. Um, yeah, so I've seen a lot happen in all of that time. When I was diagnosed, just to give you some idea, sentinel lymph node biopsies were not standard, so I didn't have that. Genetic testing was not standard. So we've come a long, long way.
I mean, for you, it's been almost 25 years. I mean, besides the things you just mentioned, how else do you think things have changed since you were diagnosed?
I really think the biggest change is that men are much more open now. When I was diagnosed, most men they kept it a secret. They didn't talk about it. They went underground. They felt like it was something they should be embarrassed about. And today, men are much more open, much more willing to speak up about it and to be present at breast cancer events and programs, which I think is just terrific.
Yeah, I have to agree. Back in 2010, as I mentioned earlier, not ever hearing or seeing another man with breast cancer out in the general population or on social media, um, it was a total shock to me. Unfortunately, I had lost my sister to metastatic breast cancer 2 years before my diagnosis, and nobody ever warned me that Mike, you could get breast cancer, or that men could get breast cancer. So yeah, now I can go on social media and see all kinds of men at different stages of breast cancer. I can see pharmaceutical companies embracing men with breast cancer. And of course, going back to the early years for me, Alamo was on the forefront of embracing men with breast cancer and inviting us into the breast cancer world for men and women.
Yes, and I think it's so important for men with breast cancer to take part in national and international breast cancer programs because it's important that we literally be a face at the table. And that's why I love coming to Alamo and other organizations that just it reminds people that men get breast cancer and we're part of the discussion.
Exactly, exactly. I mean, my first experience with men with breast cancer was seeing a TV show in New York City called the Katie Couric Show. And
Uh,
on that TV show, they had two male breast cancer survivors. One was Brett Miller. He was 24 years old. And the other was Richard Roundtree. And for those of you who are not familiar with Richard Roundtree, he was, when I grew up, like a cool action figure. And he had a show called Shaft. And here these two guys were on national TV talking about male breast cancer. And I was like, wow, what am I so embarrassed about? Why can't I talk about it? And they ran credits and showed the Male Breast Cancer Coalition information, and I dialed in and got Peggy Miller. She's the director for the Male Breast Cancer Coalition. She also happens to be um, Brett Miller's mother. And the coalition, for me, has given me just an amazing platform to help raise awareness. The Male Breast Cancer Coalition, provides a meeting place for early stage men as well as metastatic men to find out information, to read each other's stories, just to find resources that are out there for men as well as women. So it's been an amazing place for me. And now we even have a online support group that we meet the fourth Wednesday of every month, and it's called Open Mic, and it's a forum for men like you and me, and maybe those who are out there and they're embarrassed to talk about it. It gives them a place to talk to other people just like them, to let them know that they're not alone.
That's terrific. And with male breast cancer, the internet has been just a revolution because before that, we were all spread out, and we never met other people with other men with breast cancer. So I love the fact that we can now connect virtually and see people. It took me years before I met another man with breast cancer. And today you can, log on and there they are. So Mike, let me ask you, we're kind of the one percenters. It's much more rare. Breast cancer is pretty much the same disease, but it's much more rare in men. Um, what do you think? What's it like being a man with what most people think of as a woman's disease?
Again, I mentioned in the beginning, it was embarrassing for me. I thought I was a freak because I had never heard of this or never met anybody. So I was unfortunately keeping it a secret in the beginning. I asked my wife not to tell anybody I had breast cancer.
Hmm.
And when questioned, I said I had chest cancer. And of course, that's a totally different disease. And, I got by like that for a while. Um, and as I mentioned, meeting my first men through the Male Breast Cancer Coalition was called an event called Tops Off, and I met for the first time 10 other males at one time, all with different stages of breast cancer, some early stage, unfortunately, some metastatic. In that group was a real nice guy. His name was Bill Becker, and he was the first person I met who not only was metastatic but also died from the disease. So it's been a long journey, but for being in that, as you said, the 1% of the population, or 1 in 833 that are diagnosed, there's a lot more of us out there. I mean, if there's 2,620 men diagnosed every year, those numbers are from the American Cancer Society. There got to be a lot more men who can come out and maybe talk about this disease with us through social media, and I am seeing it. I'm seeing a major change from when I was first involved in breast cancer advocacy to now, and I'm sure you're seeing it too, as you mentioned.
Very much. And I also see growing awareness in the medical community in the sense of, some places that used to be called women's imaging centers are now changing to breast imaging. And, they're when I was first diagnosed, it was you go to, get my mammogram and stuff, and they're kind of stunned, and you felt like you were an outsider. Um, and also even I love going to breast cancer races and other events, um, to be a face and to represent men, and it is a reminder. On sort of a related topic, have you ever thought, is it easier or harder to be a man with breast cancer being a woman with breast cancer?
That's That's a tough question. Everybody's story is different. In our U.S. culture, I think it's much more difficult for women with breast cancer because in this culture, the breasts have been, taboo or just a female's disease. And when people are going through issues, possibly mastectomy or lumpectomy, it's got to be super emotional because society's put so much, um, you know, on the female breast. For me as a man, yeah, I'm emotionally, going through the whole issue of again having a female disease because that's the way I was raised and learning that men can get breast cancer too. I think between myself and my sisters out there with breast cancer, cosmetically much harder for them. Emotionally and physically, I suffer a lot of the issues that they suffer. I was on hormone therapy for 8 years on a drug called tamoxifen, and it totally changed me physically. It changed me mentally. It just had so many adverse effects. So I definitely struggled with the disease, so to speak. But I think I think it affects women much more. I've been in a lot of group settings, and it's emotional for them. You and I have been to San Antonio, and we're really putting a face to male breast cancer along with the other guys out there. And you mentioned earlier about going to a female breast imaging center. I can remember the first time I went for my mammogram. I was segregated away from any women who were waiting to go for a mammogram. I can remember the forms I had to fill out besides being pink. Asked me if I was breastfeeding, asked me when my last period was. Um,
Hmm.
just, it kind of stigmatizes the guys from, coming out and talking about it.
Right. I remember being asked, on the forums, was I pre or post menopausal? And I wasn't entirely sure what what I was. And of course, back then, and to a large extent today, they treat men with breast cancer pretty much like women who are postmenopausal. And we're getting better and better information. And certainly, the surgery and chemo has been fairly similar. I think the biggest differences relate to hormonal treatment. And like you say, tamoxifen has been the standard hormonal treatment for men. I actually began tamoxifen but had to stop because there were just too many side effects. And, men are much more apt to have problems with tamoxifen than women and more apt to stop. But it's still the standard treatment. And it makes sense, the hormonal systems of men and women are obviously different. And treatments have to be different.
Yeah.
One thing that really excites me these days is that we're doing much more about um, gathering data on men with breast cancer, and there are more consortiums of academic centers, that are sharing data. So, we're so small in number, you want to have bigger numbers to do research, and we're finally doing more of that.
I mean, just last year in 2019, the FDA came out, with some new guidelines urging men to be included in clinical trials. Again, we've been taking all the same drugs and the same treatments as women all along, and when you mentioned about the tamoxifen, boy, when I read the label of the side effects possible, I think I ticked off every box for every one of them, from the hot flashes to the cramping to the, sexual dysfunction to, being irritable or anxious. I hit them all. But yeah, mentioning we want to see more men included in clinical trials, and with the FDA's guidance now last year, that's happening. Um, we're opening the doors for more and more men to be involved in the clinical trials. I mean, I'd love to know if men who are on hormone therapy, such as tamoxifen, I was on 20 milligrams, every day. Is it possible to give men maybe a smaller dose or split the dose, maybe to limit some of the side effects? I'm not too sure, but if we could get more clinical trials involved in men, I think we'll get more answers that'll all eventually culminate in better treatment for men, and getting more men to be willing to go for the treatment, because like yourself, I heard a lot of guys who started tamoxifen and after a very short time had to come off of it because of all the side effects.
Hmm. So Mike, I'm sure you talk to guys who are newly diagnosed pretty often. You're very public, and I'm sure guys reach out to you, and you probably have people call and say, "Hey, Mike, you don't know me, but I was just diagnosed with breast cancer." So what do you tell them?
Um, I do get a lot of people reaching out. I've been with the coalition many years as a lead advocate, and I'm not a doctor or a scientist, so I don't give any advice like that. But I do tell newly diagnosed guys, number one, you have to be your own best advocate. You have to research your diagnosis. You have to use all of the resources available out there, and there are so many new resources out there for anyone with breast cancer, not just men. The Male Breast Cancer Coalition.org, all one word, is a great place for men to start, to meet other men, to read other men's stories, to see resources that are out there. Um, knowledge is power. I totally agree with that. But the most important thing is, don't be a fool like I was in the beginning. Don't be embarrassed. If you see some of the symptoms, we were never taught the symptoms as young men. To look for redness or swelling or a nipple discharge or puckering or thickening of the skin or a lump. If more men were aware of the early warning signs where they could go to their doctors and possibly get treatment, as we mentioned, out of those 2,620 men diagnosed every year here in the U.S., 520 of those guys are going to die due to the latter stages of their diagnosis because they didn't know these early warning signs, or because they were embarrassed to talk to their doctor about their breast. So that's the biggest thing I could tell them is, don't be, a fool like I am. If you feel something, talk about it. Um, Learn how to do the self-breast exam. If you're a high-risk male, you have a family history of breast cancer on either your mom's side or your dad's side, most people are unaware that the BRCA gene can be passed down either from the male side of the family or the female side of the family. And any man with breast cancer should go for genetic testing. That's just a give me. But there have been disparities in the past with men not receiving proper treatment, maybe misdiagnosis. Um, but I would tell the guys out there, first time people, um, use the resources, and bring somebody with you to the doctor's office. When I first heard the diagnosis, Mr. Singh, you have breast cancer, the only thing I could think of at that point, Bob, was I was going to die. Because my only experience was my sister, and she died within a year of her diagnosis. And anything the doctor said after that, I wasn't hearing. So I brought my wife with me, and she heard everything the doctor was saying and was able to relay all that information back to me once the shock and awe, you know, was gone. So I would tell guys to bring people with them also.
Hmm. Good. Yeah, and I always tell people, that you aren't alone. I think a lot of guys with breast cancer tend to feel isolated, and you don't have to, and to reach out just to make a connection with someone like you or me or some other guy who's been through it makes it much more normal. And so I
Exactly.
always, yeah.
Turning this disease into not just a woman's disease or a pink disease. Guys like us are putting a splash of blue into this sea of pink, making it more normal. My wife and I were watching TV last year, and I can remember the first commercial. Now, I'd seen tons of commercials for metastatic breast cancer in women, and the first time I remember seeing a commercial for Pablo Ciclib, otherwise known as Ibrance,
Hmm.
and they said for the treatment of men and women with metastatic breast cancer. I was like, they're talking about men finally in these ad campaigns. So the more pharmaceutical companies that come out and talk about it, the more doctors who learn about it, the more guys like us are out there advocating. It's going to become more normal and become just a people's disease, not a woman's disease, not a man's disease, but a people's disease. And I think we'll save more lives that way.
I think that's a perfect final thought. So Michael, thank you so much for sharing your story and being with us today. Thank you to the Alamo Breast Cancer Foundation, and thank you all for listening. Take care.
Having me.